Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our monthly web video series. This month I'm talking about price transparency. You've got that right. This issue is and will continue to be a hot topic. Each week brings new reports of consumers struggling with high deductibles, medical debt, and the mysteries of healthcare pricing policies. All this attention is shining a bright white light on how we communicate with consumers about their financial responsibilities. Some might say it's just a fad, but really, it's the new truth, the new consumerism. It's a fact. We're all being asked to take a more active role in shopping and paying for healthcare services. In no other market would consumers be expected to make purchases without knowing up front what it's going to cost them. I can't imagine buying a new car or even putting gas in that car without first knowing how it's going to affect my wallet. Healthcare consumers today deserve no less. In other words, it's a reasonable request. Price transparency isn't a new issue for HFMA and our members. We've actually been talking about it for years. You might remember our patient-friendly billing reports. The discussion picked up steam when we launched our Healthcare Dollars and Cents initiative, working with key stakeholders to make the financial aspects of healthcare easier for consumers. Through that project, I've been encouraged to hear stories about efforts to improve processes, practices, and data. Unfortunately, I've also heard from people who seem to believe this issue isn't worth their time and effort. One health plan executive recently told me that only half of the providers in their network are willing to support price transparency. In another eye-opening conversation, a provider executive said he thinks the movement toward price transparency will soon pass. He said the current push is being driven by the media and a few other people who want to distract attention from other issues. In our report, HFMA's Price Transparency Task Force recommends that health plans be the primary source of price information for their members. Of course, that's only possible if health plans have the cooperation of the provider community. Unfortunately, not everyone's on board. First, I realize the challenge involved. This is hard work. I've done a lot of this in my days as a CFO. I understand the issues. But like I've said, these are reasonable requests from consumers. As healthcare finance professionals, we need to keep our feet on the gas and champion a consumer-centric approach. There are several steps you can take right now. First, adopt the best practices for improving patient financial communications. Then demonstrate your commitment to your communities by becoming a PFC adopter. Offer customer service training to your revenue cycle staff. Do a walkthrough of your processes through the eyes of your patients and customers. And most importantly, don't kid yourself. Healthcare consumerism isn't just a fad or some temporary media exploitation. It's the way of the future, our future, and it's time to act. Thanks for watching. I'll see you next month.